Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? Broken neck. No, really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray we see that it was there prior to the operation. After questioning the patient he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately he passed away about 2 weeks later due to the cancer. Next story. Patient was lactating but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. Edit, wow, I didn't think anyone would even read this or I would have explained better / tried to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist, who took over care. Also, please, if you are concerned about your health in any way or are not happy with your doctor / care, obtain your medical records and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health. Next story. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him, at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so patronizing with our concerns and shove his face deeply into his own butt. Next story. I suppose I have one for this as a resident doctor. We saw a kid in the EMERG for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip. Then the other hip. Gave some Zofran etc. Turns out on exam he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me and I'm not even good at this yet. Did a CT scan. Big butt tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Edit, thanks everyone. The history was that he really declined further over the last few days prompting the ed visit, so he looked really bad for us but I'm not sure what he looked like before. To any med students reading this, 1. Do an exam. 2. It's okay to cry sometimes. Next story. My best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain and her doctor said her ribs must be fractured. Long story short, it wasn't fractured ribs. At some point when the pain became too much to bear, she went to the ER and got a CT. Turns out she had stage 4 colon cancer with 4 inches tumors in her abdomen that were compressing her organs and causing the pain. She died a few months later. She'd been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy she'd probably still be alive. Next story. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays, told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. Next story. MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Next story. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly I don't know what happened to him. Next story. Once when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen, and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, next set of vitals, his temp was 103F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. Next story. Speaking as a patient. When I was a kid, my eyes were hurting and my dad kept taking me back to the same eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals to wash them in. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, after a year, my mom forced my dad to take me to a different doctor. Literally, he met me in the waiting room, looked at me with his naked eye, and said, "You have a raging eye infection." A month of medicine and the infection was gone, but there was so much scarring and damage it was 20 years before I could wear contacts again. Edit, getting this question a lot. I was a kid at the time. I didn't know the difference between an optometrist and an ophthalmologist, and it was over 2 decades ago. I do not remember if I ever knew. Sorry, I can't tell you. A lot of people are saying that optometrists are basically just for routine checkups and getting glasses or contacts, and if something is actually wrong and you need a diagnosis, go to an ophthalmologist. Update, am now getting pushback on this, too. Apparently the distinction between optometrist and ophthalmologist is less drastic than some of the earlier people implied. Again, the only thing I personally recommend is that you do your own research and come to your own conclusions. I don't personally know if that's true or not, but feel free to do some research. It's a thing several people have said now. I've only gotten the one troll so far showing up to tell me he is 100% sure I'm lying because that's clearly what people do for fake internet points and he will not have it, which seems low for a Reddit post. So I'll take that as my good fortune of the day. Next story. Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, "So how long have you had MS?" That was the first she was diagnosed. She had been battling various MS symptoms for a couple of decades without a diagnosis. Next story. In residency, I saw a cardiologist miss a STEMI heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically, his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily, he made it through though.